people to get on these.
Fake background.
We'll start. Make sure you. We got a green screen, but there's gonna be something cooler there in a sec. You guys, please ask questions via the chat if you have any, and I'll make sure I get to them towards the end. Talking about chin implants. I think we're about there. We're 1 minute, a little bit after. Casually late. So I'll just kind of get going. We'll record and post this so people have that information. Chin implants. Chin implants probably one of the most powerful things I do for jawline sculpting, really to get those contours in certain patients. So it has to be the right patient, but it really is probably one of the most powerful things that we can get accomplished. So you check out my Instagram, my new Instagram, because I got kicked off, at Dr. Ben Coughlin, at Many Faces of Chicago is currently having technical difficulties, not related to the Capitol insurrection or anything like that. I'm just getting censored. So there's a couple of implant options behind me. I'll go over those shortly. But again, so chin implant. Why is it the most significant of the procedures I do? The reason is probably the amount of volume that's done at one time. So you can also do a mentoplasty or submental advancement of this this chin, but I prefer the implants, to be honest. So it's the right patient, but it's that person with kind of a soft chin. And it's not that they necessarily need a chin implant, but that we can use the chin implant to pull the chin anterior, which then lengthens the jawline, lengthens at least the appearance of the body of the mandible. So that's what gets you that long, straight, linear line along the jawline, which is what most people are after. You could do it with fillers, but implant material. So here is a silicone implant, and there is a polyethylene mixed with a Vicryl type material. A little bit more of a contourable process here on my left, and then on my right is the silicone. I prefer the silicone in most patients, but we do adjust it to people's needs. It's kind of a tailor-made procedure. These are bulk implants, so you see a big change right off the bat. To get this in, I have to, this is the mentalis muscle. There's the depressor angularis oris or labialis, and these muscles are lifted off the mandible. The implant is placed under them, and then they're re-secured to the mandible. So because of that, with the implants, you typically have a little bit of a downtime. The lip kind of feels weird. The speech can be a little bit off. Eating can be a little bit of an issue for like a week, not long term, but for a week. Even the smile can be a little crooked for that week while things are swollen and kind of healing. So that's an important thing to appreciate there. But this sharp cervical mental angle, that's from the chin line up to where the neck meets kind of the hyoid bone straight down. So that having a 90-degree or even less, more of an acute angle is attractive. That's what people are kind of after these days. You'll see the models in magazines, they even airbrush that in. They'll take away a little bit of this angle here. So in things that make people not like their cervical mental angle or their profile view is a low hyoid bone. There can be a lot of subcutaneous fat in that area. And then the soft chin really is something that's underappreciated from the general public. Most surgeons would appreciate it, but definitely from the general public, they come in and they say, I have this fat under my chin, and there's nothing there, or there's fat on my neck under my chin, and there's not fat there. It's just the fact that the chin is too soft. So as you project the chin anterior inferior, it helps create that angle. Sometimes it's a combination of those things you need, and in most patients I do a combination because with the implant you're looking at the little bit of submental fat that's there, so I do kind of remove that or sculpt it. You can also tighten the platysmal muscle. That also helps define that angle. And these are things that are often done at the same time because, again, I'm right there. Fillers work for the chin really well. We have Radius, Sculptra, Bellatero, Belafel, Voluma, Velour, Juvener, Ultra, Plus, Restylane, Lift, Define, Refine, Silk, L, Teoxane, 1, 2, 3, 4. We have at least a dozen fillers now. They differ by the viscosity. So the firmer, the more viscous fillers is what you want for the chin because you're mimicking bone. For the lips, you want one a little less viscous, like honey, consistency. And then even for the eyes or really fine lines, you want the one that's closer to water. So those are things that you have to take into account. So if you want more of a pointy chin, sometimes the fillers can get can be better for that. If it's more of a jawline enhancement, jawline sculpting, the little bit more of a boxy, which I know is a bad term in facial aesthetics, particularly for women, but a little bit more of a boxy chin is helpful to get that jawline sharp. So, you know, the key is, you know, being clear with what you want, with your goals, and then finding a surgeon or a doctor that you trust so that you guys can work together to get the goal. So, you know, we have so many tools in our armamentarium now. We have fillers, laser devices, heating devices. We just have this new thing in the office, New Era. I mean, it's this spectacular device that has a radio frequency delivered to different layers. It's safe in all skin types, all types of patients, ages. So it's really neat to be able to use these. Then we have fillers, we have implants, we have surgery on the bone to enhance. So, and you really, I mean, I think that's what's nice about what I do, because since I stick to kind of a microcosm area of the face, or of the, well, of the face, but definitely the body and even the face, my thing is kind of the neck, jawline, and chin. I really am confident doing anything that is needed. So I think I'm able to give people what they want because of that. So, you know, we have a couple questions, I think. Paige, you can just read me those.
Show some before and after.
Yeah, great. That means we don't have any questions. But yeah, do you have some saved on the computer? No, probably not on his, no?
Nope, I just showed it.
Okay. Yeah, so it's you know, demonstrating with before and afters is I think key for these. Again, my Instagram got kicked off, being censored. But so good. This is a good one here. Yeah, let me see there. Perfect. So the before is on this side and the after is on the other side. So what's crazy there is it flipped for me. Okay, well, you guys get it. What's crazy is this is the after, or excuse me, this is the before, the other is the after. Look at how the lip, this was a chin implant. Look how the lip is supported. The jawline is kind of lengthened, and the mandible is not lengthened. It's artificial, but it looks like it is. I mean, she just looks so much more contoured, so much more elegant. I mean, she looks 12 years old in this photo and like a, you know, grown woman in the other photo, which is why this woman did it. She's not 12, because she wanted to, you know, get a little bit of a, I mean, to be honest, a little bit more respect for, you know, it's unfortunate that that's how people are. That's how the world is, but that's how it is, man. So deal with it. Come see me. Yeah, another one. So this is the frontal view. Again, I mean, it's just, this was like life-changing for this woman. The lip, it's like she used to complain that she had a dry mouth because, which can lead to, like, you know, cavities and all sorts of issues, because her lip sat in repose open. So after I was able to support that lower lip and those muscles of the lower lip by with the silicone implant, bingo bango. You know, I think it's just it was a really, this is a good case, and this is a kind of a typical case. Hard to get these results with filler. You can contour, you can help, but hard to get this much of a support with a filler. Some of the threads we're making some changes, you know, a little more rigid structure, but in my experience, the implant is really what makes the biggest difference. So again, I think it's obvious pre and post. You can see how I lengthened her jawline to really give that contour. Like, look, this is somebody who would come in and say they have jowls. They would say, oh, look, I have these jowls. And I would have to explain them. Those aren't jowls. That's just lack of support for the skin and soft tissue to drape on. So, you know, be careful with Google. She's Googling and saying, what's this fullness of my lower face? I have jowls. You know, so another doctor would tell her she needs a facelift to treat her jowls. She's like 30 years old. So that's not the right treatment. Small chin implant, 1 week downtime, you know, she's super happy. So again, be clear with your goals, find someone you trust. I think that's good. Got a lot of things to do today.
One question.
Okay.
Where are the incisions for a mentoplasty?
Similar, typically similar to a chin implant. It's just under the chin here. There's a natural crease, and we're able to hide it in most patients there. You can go through the mouth. If you're doing the bone work, which this person kind of alluded to, it's hard to go through the mouth, and there can also be infection risk going through the mouth, meaning inside the lip, to be scarless. But really, honestly, this submental incision, rarely can people find it after a few months. Definitely by 6 months, and then we can laser and we can flatten them out. So that's where the incision goes. It's about 2 centimeters, less than an inch. The incision.
Thank you.
Yeah, very welcome. So yeah, I mean, I think that's what I have to say about that. If you have any questions, you can DM us however you want, but at Dr. Ben Colgan is my Instagram. Just made an awesome TikTok video today. That's at Many Faces of Chicago or whatever, hashtag Many Faces of Chicago. Signing off.